Hi, I'm Dr. Beech. A very, very common area to hurt is in the shoulder blades. So right between the shoulder blades, in that area, patients come in with pain there a lot. And there are a few different reasons that we can get pain in that area. Certainly posture is one of them. If there's a lot of forward head tilt where the head is going this way and the shoulders are rounding forward, that puts a lot of stress there. Overuse, using our arms all the time, that can put stress there. A more serious kind of problem would be if we had a disc problem in the neck, in the lower part of the neck, like at C6, C7. It can aggravate the nerves going into that area, the long thoracic nerve that innervates the rhomboid muscle in that area can become inflamed. If that's the problem, then we have to treat the neck and the disc problem. But a lot of times it's just tension, and the rib joints in that area become very tight. So as a chiropractor, I always try to figure out exactly what the etiological factor is for each particular patient. They've been in a car accident, they're overusing the area, they have bad posture, maybe they're pinching a nerve. We have to understand what the real etiological factor is and then treat it appropriately. So treatment for this kind of pain usually involves adjustments of the thoracic spine and the rib joints around that area because the rib joints become so painful. Also, when we're adjusting the ribs, we have to check the ribs in the front because the ribs go all the way around. So whatever's going on in the back is many times happening in the front as well, even though there may not be pain associated with that. When we palpate them, they'll be very tender, so we adjust both sides. And then finally, I use my transdermal creams, my Ayurvedic transdermal creams. So on this area, I like for those kind of trigger points, I use Mahavita Nishanti or Super Sport. And then a new cream, well, it has a new name. It's an old cream. It's called Pain Free Cream, but you'll see under the description the new name of it. That cream is very good for breaking down the trigger points, and it's just to massage into that area and work those knots and tight areas. And I suggest that my patients do that twice a day, that maybe in the morning they massage it in and work through some of the knots. Now, that's a hard area to reach it. You really have to have somebody else kind of help you bring your arm up and pull the shoulder blade up and then have them massage into it a little bit. And then in the evening, just swiping the cream on that area, usually from top to bottom of the shoulder blade. Doing that twice a day helps to break down the knots and the adhesions that have accumulated in the rib joints and the insertion of the rhomboid muscle tendons into those areas. So it helps to break down those areas. And usually with proper treatment, correcting the posture or just working the area and getting mobility back into it, usually that pain goes away fairly quickly. So if you have any questions on treating this kind of shoulder blade pain, then please give us a call and we're happy to answer your questions. Thank you very much.